Hi, my name is Mark Erdelyan. I work with the Erie St. Clair Local Health Integration Network. I'm a lead health system design, and I'm working in chronic disease prevention and management. The area that I'm working in is chronic disease prevention and management, and what we're doing throughout this particular program area is developing care pathways to assist people who have developed a chronic disease and making sure that they receive better regular care throughout our community, making sure that our services are not only timely but efficient. As part of the planning process, we've been working with a number of stakeholders throughout the community, including physicians, community healthcare organizations, and of course patients, to ensure that these pathways will meet the needs of clients from across our community. Here in the Erie St. Clair LHIN, three of the chronic diseases that we're currently working on are CHF, COPD, and diabetes. The development of these pathways will help the community to ensure that physicians and other service providers have a clear understanding of where they can refer their clients to. And the rationale for working in this particular area is the fact that within the Erie St. Clair LHIN, we have higher rates of chronic disease as compared to other parts of the province. One of the areas that we're currently working in as part of our chronic disease prevention and management programming is smoking cessation. We know the impact that smoking can have on an individual's health. A recent research study showed that only about 5% of smokers are accessing smoking cessation services across the province. What we want to do is develop clear pathways to ensure that those individuals who are interested in smoking cessation are getting to the proper services in a timely manner. In terms of reaching smokers, a group that we need to work more closely with is physicians. We know that physicians can play a key role in helping to address whether a client is interested in receiving support for smoking cessation. A model that we're currently working with is the Ottawa model for smoking cessation. We're currently exploring how we can utilize this model throughout the Erie St. Clair LHIN and working with physicians in terms of helping them not only identify but screen for patients who are interested in seeking smoking cessation services. One of the reasons for developing a care pathway for smoking cessation is to ensure that patients have information about where to go in terms of getting help. One of the things that the research has noted is a number of clients are not only unaware of services, but have also faced difficulties in terms of reaching a service that's most appropriate for them. The care pathway will help to ensure that people access services not only in a timely but efficient manner. In terms of getting more information on this particular program, you can contact us through our website or through our toll-free number.